we've been active doing meditation in our temple for so many years. Last year we had a 3-day seminar, conducted a workshop with 100 plus 150 people attending around the state. And I thought it's important that we understand why we need to meditation. So, I had a chance to discuss this topic 3 months ago at the Maple Grove Hospital. And the discussion on medical imaging is very primitive level. I want to acknowledge the presence of Murthy Taravarthi, who is the outstanding professor of radiology at the U. For him, this is absolutely nothing as far as imaging is concerned. But I think it's important that we, as individuals who want to pursue or pursue the meditation, understand some scientific basis for it. So here it goes. Every one of us wants to become rich and famous, and in addition wants to remain happy, healthy, and of course young forever. In order to find all these challenging goals of fame, fortune, and everlasting happiness, we tend to pursue a very fast-paced life when there never seems to be enough number of hours during the day. When I was practicing radiology, I thought I should move to Mars because there are 36 hours in a day, so that we can increase from 24 to 36 hours. If we just look at us, ourselves when we were youngsters, with our demanding jobs, and sometimes many jobs, or family responsibilities, of course high maintenance spouse and children. Of course every husband feels that the wife is high maintenance, and the wife of course knows the real truth is the other way around. Commuting through congested traffic to get to the place of work every day morning and coming back. Visiting grocery stores when you're exhausted and everybody's in the grocery store at the same time. Driving children to all the extracurricular activities they have to be kept busy at. And of course, our personal needs to keep up with the traditional news media and the endless personal 24/7 online communications. The day ends before we know it. We fall asleep totally exhausted, only to get up early in the morning. A little bit refreshed, but to start the very same exhausting daily routine all over again. It's no wonder with all this kind of lifestyle, we tend to eat fast food on the run, have no time for any kind of regular exercise, rest or relaxation. We are always tense and wound up. Our blood pressure is up. Our sugar level is borderline abnormal. And we always seem to be on the edge. Let's face it, we know that at this rate, catastrophic illnesses are just around the corner. Tragically, many of us, in our so-called successful life in this material world, we indeed lead such a lifestyle. Hopefully many of us have gotten over it by now. Even though we see death all around us and peruse through long obituary columns every day in the newspaper, we still believe that we are somehow invisible immortals. I'll confess, I go through the obituary column every day just to make sure that my name doesn't appear in it. Because if it does, there is really no sense for me to get up and continue with my daily routine. So that's the only reason I go through every day. In the last three earlier sessions, I had the opportunity to discuss how to remain in constant state of happiness living a Hindu way of life. And we learned through those three sessions that it's not what you do that needs to be changed, but how you look at the things and how you do the same things with different vision is that really changes. That way of thinking, that way of looking at the things is called the Vedantic vision. And that Vedantic vision is simply this, to remain as a true devotee of Bhagavan, God by any name, perform every action that we have privilege to do as a service to God, and remaining generous and charitable towards worthy causes. And if we do that and lead a life of discipline, you'll reach that ultimate goal of remaining constantly happy. Meditation done on a daily basis is an essential and integral part of that self-discipline. Now, many of us tend to get our information, in quotation mark, through the 15-second sound bites that we hear on the radio or news media or TV stations. And we have heard many times that meditation is good for you. But of course, your life is so busy, we don't have time for it. Too busy to meditate. You probably know already that usage of meditative practice for healthcare has increased in the United States from, what's that? Next. 7.6% in 2002 to 9.4% in 2007. And that is one of the most commonly used complementary and alternative therapy. Next one. About 10 million individuals in the United States meditate, whereas hundreds of millions meditate around the world. You can see, we have heard also that meditation increases the alpha and theta brain waves, linking the relaxation and periodic aha moments. We also heard increased activity in the centers of empathy and compassion in the brain, activity increases concentration and equanimity, helps lower the anxiety and slow down the process of aging. And we heard all that. We also heard through scientific articles that a process of aging of the brain also slows down with meditation. And with all that information that we have, we consider ourselves of being scientifically minded. Unless I have a hard scientific proof, I'm not going to accept anything that what I hear. And my purpose this morning is to really share with you a closer look of the meditating brain through the magic of medical imaging, especially I had the privilege to enjoy for 50 years of my professional life. Let's review the neuroanatomy first. Don't get nervous, any one of you. I will make this very brief and relatively painless, only to make a point. Brain waves just a little more than 3 pounds. Whether you are a 100-pound weighted individual or a 300-pound linebacker in football, the brain weighs only 3 pounds. Now, there is a narrow brain stem which is connected to the spinal cord, which consists of bundles of neurons which are vital to keep us alive and conscious. Unfortunately, I don't have it pointed. Can everybody identify the spinal cord there? And the cerebellum, the small portion back. The cerebellum at the back, at the bottom, is a convoluted mass of neural tissue. I won't go into the entire physiology of cerebellum. Suffice it to say that that cerebellum helps maintain body balance and muscle coordination. Now, cerebrum is the largest part of the brain. The upper layer of the cerebral cortex consists between 70 to 100 billion neurons. And what's fascinating is, I don't know if you heard Dr. Michio Kaku from the University of New York. He's written about the future of the brain in Meditating Brain. Not meditating, just talk about the future of the brain. He counts about 100 billion neurons. And knowing about the Gayatri Mantra and knowing about the Milky Way in our galaxy, they consider 100 billion stars in the Milky Way too. Something to remember exactly how it is. Because most of our human body, just like our Hindu temple upstairs, which are representative of the human body, even our human creation also is related to where we are in the Milky Way. As a matter of fact, our relationship between the Earth and the Moon and Earth and the Sun also has a specific spatial calculation, which I'll show you, discuss with you upstairs when we go upstairs. Basically related to 108 times, but again, that's a different discussion altogether. Now, this cerebral cortex is only 3 to 5 millimeters in thickness. But even though it's only 3 to 5 millimeters thick, it takes up 1/3 of the brain volume because it is folded. If I was to describe it, it's like a shell of a walnut into a maze of hills and valleys. I like walnuts, of course. I like all kinds of nuts, living and non-living, but so basically walnut is a perfect way of understanding how a convolution of the brain is really works. There are 4 major parts of the brain. One in the front, which is frontal, parietal in the middle, occipital in the back, and temporal at the bottom level. Now, if you go to the next one, please. If you look at it, on the frontal lobe, which is shown in blue, the back portion of that frontal lobe, remember, the frontal lobe, in the front, the blue side of the tip in the front, that's the front of the head, that's the back of the head. The back portion of that blue segment of the brain called frontal lobe is the primary motor cortex. And this coordinates movements of the lower movements of the body. That's what is involved in. The lower portion is relevant to the discussion in certain kinds of meditation. It's shaped like a, go to the next one. I'm going to come back again. If you look at it, there's a crescentic structure. Can you see the cingulate cortex that is shown there on the top? Looks like a small boat or a sickle-shaped structure. That's the inside aspect, medial aspect of this frontal cortex. And that is the one which is involved as far as the certain forms of meditation. So those are the areas you have to remember. Then it regulates some of the functions of the autonomic nervous system, something to remember connection with it, including the heart rate, breathing rate, blood pressure, etc., as described by Devinsky in 1995. Go back to slide 5, please. Back. Now again, coming back to the earlier slide, the yellowish shows the parietal portion of the brain, parietal lobe. And if you see, there is a front portion of that yellow parietal lobe is the somatosensory cortex of the brain. It receives and analyzes information regarding the pain, pressure, touch, and temperature from all parts of the body. Towards the back of this parietal lobe is a sub-region called, small sub-region called superior parietal lobule, which becomes active when people try to visually determine the location, depth, and trajectory of objects in physical space. So when we are identifying our form, shape, location, and timing, that particular aspect of the brain gets involved. Because really speaking, maybe confusing people, but we identify ourselves, our human body, because we consider ourselves as having a particular form and living a particular time period. So the time period is infinite and we really don't have a form. If you don't understand it, forget about it. We discussed in the past, discussing Vedanta. But that is a sense of form, shape, type, time. That's what the brain identifies at that particular time. The importance of that, I'll come to you when I start showing some of the images. Now the temporal lobe, the one which is shown in the purple color, is the which one is contains the auditory cortex, chief area for sound and speech processing. And if you go back to slide 6 now again, the inner aspect of that temporal lobe, I want you to identify a structure which is called hippocampus. If you see the second word underneath, and you can see the arrow in the front, that's the medial aspect of it, which is involved in memory. And the one at the very tip of that is called amygdala, which is involved in the emotions. Now the reason why I want you to identify those structures, remember them, when I start showing the images, then you'll understand the relationship of those particular structures. And then if you go back again to the previous slide, please. You can see the green color is an occipital lobe of the brain, which is a primary visual cortex, where the signals from the eyes are processed. The people with impaired visual cortex can be mentally blind, meaning that they are often unable to perceive the objects in front of them, even though their eyes still respond to their presence, because pupils can contract, the eyelids can move, but if that occipital lobe is affected, not functionally active, they are mentally blind. So that's how the structures are. Now, this is just laying down the groundwork. Don't get lost in it, but show you some fascinating pictures. Our abilities of imaging the brain have improved dramatically, and we have started understanding the functioning of the different lobes of the brain as well by different kinds of imaging techniques. Now, there are three advanced technologies which I have developed over the years, recent years. Unlike the static images of standard MRI, magnetic resonance imaging, there's a functional MRI, next slide please, next slide, which provides ongoing impressions of the working brain function in relation to the behavior. The technique uses BOLD standing for blood oxygenation level dependent. Doctors like to make these mnemonics to make it easy to remember and confuse other people. Blood oxygenation level dependent BOLD hemodynamic response. It measures the amount of oxygen in the brain as a result of the cerebral blood flow. Simple. Basic principles in medicine, just like everything else, are simple if you understand them. It is based on the simple principle that the most oxygen-rich areas represent the areas which are neurally active. That's common sense. This in turn allows us to infer which regions may be functionally associated with that behavior, as described by Buxton in 2001 and Logothitis in 2008. Now, if you look at it, the next slide, I could not get the MR scan at this particular time. I'm going to show you a picture which is with a slightly different technology, where you are able to see on the left-hand side is a baseline of a person. On the other side, on the right side, this side is a person who does meditation for many years. If you look at the front area, I don't know if you, when front is on the top area, you'll see the area shown in the red blobs. Those are the areas of the frontal lobe, front area. If you see the baseline, you'll see this certain amount of red blobs. But I want you to understand that on the meditating brain, person who is meditating for more than 9 years, you can see the redness in that area is significantly greater in the frontal area. So when you start doing meditations on a regular basis for a long period of time, the blood flow from that area is increased, indicating that particular portion of the brain is far more neurally active. Go to the next slide. And if you look at the normal baseline on the one side and the meditating brain on the other side, if you see the arrow on the left lower, the posterior parietal lobule I was talking about, inferior lobule, that area is not as red as the person who is not meditating. That is the area where we tend to have an understanding of timing, form, position. That kind of identification of an individual is diminished. So when we are doing the meditation at that particular time, your recognition, your identification with your own human body is diminished. So you're no longer attaching yourself as representing your bodies. That particular area is diminished. Go to the next one. The second technology which is described is called PET scan, positive emission tomography. So what we do is an intravenous injection of the tracer which contains a weak radioactive isotope which leads to a gradual emitting of positrons as the isotope decays. And when these positrons interact with other subatomic particles, they produce X-rays that can be detected, counted, and mapped by digital scanner. That's the basic principle. Again, the same basic principle applies. Increased blood flow of a portion of the brain indicates increased positrons that produce increased X-rays that can be detected. So you know that area is active. Similar to functional MRI, PET scan follows the idea. Same principle. Increased blood flow, increased activity, increased function. Again, this was reported by Vishwa in 1990, Schneider in 1995. Go to the next slide, please. Now, if you look at this, on the top you'll see that there is a circle there. The baseline, you can see there's a certain amount of activity in the left side of the brain, but the person who has been transcendental meditation practitioner for a long time, that activity is increased in the frontal area. That area is of concentration, focusing, cognition. Whereas the autonomic nervous system, with the central middle picture shows thalamic area, is decreased. Again, if you see the cardiac nucleus there, basal ganglia show decrease. So basically, when you are meditating, the areas which can be focused, the activity increases, and the autonomic nervous system activity is diminished. That's the whole purpose of doing it. And PET scan basically confirmed. This was a Newborn's article in 2001, and he's written a book on brain. The God doesn't go away. It doesn't matter what particular faith one practices. So he's from University of Pennsylvania. The third one is, we go to the next one, it's called SPECT scan. It proceeds in nearly the same way as PET scan. We try to split the hair just to make it confusing. That way we are able to do more tests, we are able to collect more money for the hospitals, but that's a different story, right, Murthy? But anyway, basically what we do with the PET scan, instead of X-rays, the scanner detects the individual photons that are gradually emitted by different kinds of tracer, and they stay in the brain particle, and that is what is recorded. Okay. Through a reaction with the chemicals found in the neural tissue, the tracer is briefly retained in the brain, thereby provides a snapshot of the brain and the brain activity at that particular time. So that metabolic activity is recorded, and this was reported to be true by Kolb in 1990 and Warwick confirmed in 2004. Again, those are interested, these are references in Google. Now, here you can see, that's fine. This was a study we started after 2005 when our Dalai Lama went to Stanford, one of the lecture series, and was exposed to the scientists doing research in Stanford. And he got excited about some of the neuroanatomy, neurofunction, and encouraged them to do studies on the Buddhist monks who have been doing meditation for a long period of time. And so this picture from one of the Stanford studies, where the monk is getting off the scanner at that particular time. So what he did was, those Buddhist monks with some who had done as much as 15 years of meditation, and if you look at their PET scan at that time, go to the next one. Now you can see very carefully that during meditation there is an increase in the blood flow in the frontal lobes, particularly on the left side. You can see both the right side and the left side, the activity is increased. Can you see that clearly in the front area? Okay. But again, these are people who monks have been doing for 15 years. Okay, next one. And again, the same thing which I shared with you earlier, in the parietal area, there's a decrease in the activity at the right parietal lobule at the back, right in that location. Because when you are identifying yourself with body, that activity is diminished. Now, there's a subtle difference between, if you have time in any question and answer session, I can talk about different kinds of meditation. But here the Buddhist monks are looking at absolutely nothing at that particular time. The shunya, that's what they're concentrating on. Whereas the Franciscan nuns, if you go to the next slide, when they were studied, their meditation is based on concentrating on a particular prayer. So they're trying to remember the prayers, remember the wordings of the prayers. That's what they're quoting on. And that's why, if you look at the right parietal area, the baseline, you'll see the activity is X. But if you see the next one, the prayer scan, can you see the local focalized increase of brain activity? Because that particular area gets concentrated because they're identified with that particular kind of prayer. They find the same kind of clinical response and improvement, but their brain scan is slightly different because their form of meditation is slightly different. But, if you go to the next slide, the same nuns, when it comes to forgetting about themselves, their body, the left parietal area again, you can see the activity is diminished. So even they are concentrating on prayer, that area is active, because neurally active. But identification with individual body is gradually lost. So it's kind of fascinating to see similarity and dissimilarity between two different kinds of meditation. Benefits, of course, are exactly the same. Okay. Now let me bore you with brain waves. Now, go to the next slide. Don't get lost. I'll bring your mind. Now what we do is put various kind of electrodes on the head and measure the electrical current that is emitted from different parts of our brain. Okay. Don't look at the pictures, just listen to me for a time. The electrical activity that comes out of the different parts of the brain is very small. Not because of our brains, but I'm just telling you the facts. About 1 divided by 1,000, 1/1000th of a volt is considered in physics as 1 hertz. Okay? And the various waves which are classified, 1 to 3 hertz called delta waves, they are seen during when you are in deep sleep. That's when the brain gets refreshed. 4 to 7 hertz are the theta waves, when you're a little drowsy, getting drowsy in early sleep. 8 to 12 hertz is alpha waves, state of relaxed awareness when you're doing meditation. Mind not actively engaged in deep thought, but just mind relaxed to do meditation. 13 to 29 hertz are called beta waves, which appear when actively thinking. And 30 to 80 hertz are called gamma waves, when person is mentally integrating and processing complex sensory information, as Ram Krishnan always keeps to do all the time, sitting back there. I know how his mind works. So you have lots of gamma activity for Ram. Now what you're seeing here is the picture on the top is that of a person who does not meditate. He's doing the activities, the mental activities going in a random fashion. There are different kind of ways which are recorded. There is no symmetry at all, no synchronization, totally asynchronized brain activity. A person who is normally thinking and acting. But a person who is meditating, in this case in the transcendental meditation, you can see there is the time series we recorded, the spectra showing a beta waves of 22 cycles per second, which is a constant frequency. If you see the peak that there, this is synchronized brain activity. So when you are doing meditation, that not synchronized brain activity gets synchronized with the specific area. So we can see exactly when somebody is in deep meditative state. Now during the normal wakeful state, you can see the brain pattern is not synchronized. With transcendental meditation, you saw how it is synchronized. Now, what is fascinating also in the studies shown is occasionally what happens. You go to the next one. This is from a young lady who did meditation for about 8 or 9 years, about 10 years, and she had a experience of a divine feeling or aha moment. And you can see there is a fairly synchronized alpha activity, but you can see peak spikes in between. Those spikes represent the areas when the aha moments took place. So you're able to see when they are synchronized. During that area of passive synchronized activity, you get moments where you feel totally disassociate yourself. Feeling, her description was, I was feeling of not being connected to the body, being connected, being to something different, feeling completely whole. That's how her description was when she described it. That was the pattern that was recorded at that particular time. If you go to the next slide here, even though I showed you the activities in this particular fashion, it can be also shown in the form of imaging by recording in the digital record. So EEG activity for the people who do not meditate, or short-term meditators, as against long-term meditators. Those who are short-term meditators are not meditating at all. The activity is predominantly in the occipital, the back portion, and part of the parietal area. Whereas who start meditating on a regular basis, the activity is primarily in the frontal and parietal area, centrally around this area. So that particular portion of the brain becomes more neurally active at that particular time. Next one, please. Now, this was a study done by Newberg et al., where he studied 14 monks who did one-pointed concentrated meditation with the Buddhist style, and they were able to find out increase in the thickness of the brain in the frontal area, and also in the areas where you are able to see insula in the frontal area. That area was significantly thicker. And when the original reports came out in 2001, I thought first, and then came this was in Locke of 1990, early stages, but Newberg basically showed 2001 and 2005 subsequently. Everybody felt that only these changes can occur in individuals who will be doing meditating for a long period of time. But what is fascinating about it is that is not necessarily the need at that particular time, because there's an interesting study done by Britta Holzom. She did some fascinating studies reported in 2011. Her studies were studies done at Harvard, Yale, MIT, and one of the engineering college from Germany. All of them combined together and got together the people who were meditating for a period of only 30 minutes a day. And they studied for only 8 weeks. So their meditation was only for a period of 8 weeks. And even though she reports 30 minutes, actually it was 27 minutes to be exact. And then she compared it with the people who never meditated. And amazingly, she found when the MRI scans taken before and after participating in that meditation movement, there's increased gray matter in the hippocampus, an area which is important for learning and memory. And the images also show reduction in the gray matter in the amygdala, a region connected to anxiety and stress. So what is fascinating is that even though the meditation was done only for less than half an hour, and then only for a short period of only 8 weeks, there was a distinct change in the function and the structure of the brain, with clinical improvement as well. And I'll stop with one more study, go to the next one, is where she also reported subsequently cerebral cortical thickness in 20 individuals with an average of 9 years of regular practice of meditation, compared with the volunteers with different ages with no meditation experience. Now, if you look at it, the one which are shown in the blue are the people who do meditation, and the one which are in the red are the volunteers or the simple subject. Is there any way you can make that one bigger at all? But even if you don't see it as much, basically on x-axis you can see the thickness of the cortex, and the y-axis you are able to see the age of the patients going with 20 to 60 years of age. And you will notice the people who are meditating, regardless of their age, the cortical thickness, blue marks, continue to remain the same higher level. Whereas the people with the red, which are volunteers, their brain thickness continues to gradually go down of the cortex as they age. So what is fascinating is not only your functional activity is improved, but even the cortical thickness remains maintained. So that's how you prevent from aging. Yeah. I'm trying my best to bore you with medical imaging. So just get the slides on. Is that the last one? Turn it off. What's the next one? Fine. You can get the lights on. That's fine. Lights up. Well, I shared with you various research papers from 1990 to 2011. I'm sure you saw some images which made some sense to you and some did not make sense to you. I showed you some anatomy and bored you with it. I'm sorry about it. But only way you go to recognize the value of meditation is by personally experiencing. So what I would suggest is either take my word for it, feel a little bit scientifically informed because seeing some images, so it's worthwhile trying it. But come back in a few more months and share with me your experiences. And I think to me the greatest pleasure would be is if you're doing it, continue doing it. If you've not done it before, start doing it from today. And I don't need anything from you, but I just want to make sure that you find the kind of peace and comfort that both Kumud and I have received over the years. I'll stop at this time, answer some questions, and then if you're interested, I'll talk about different kinds of meditative techniques that we can do. So, any questions? Well, thank you. Coming from you means a lot to me. Thank you. Really appreciate it.
What was the question?
We was saying it is not easy to communicate these kind of scientific studies in a language that an average person with no medical training can understand it. So we thought it was a very nice way of doing it. Am I right? So, the most difficult thing is to make it simple. You can talk medical words and only people who practice that medicine understand it, but that's not the way to do it, isn't it?
So were all of the slides people, the meditators taken during meditation?
Yes.
So then the question is, how are there any permanent changes to the brain if they take the slides when they're not meditating?
Good question. I'm glad you asked that question because many other people who did not ask that question asked the same question. The question was, the images that I showed you were, some of them were during active meditating practice and some of them were during the time when they were not active practice. For example, when we talk about increased thickness of the cerebral cortex in monks who have been practicing for 10 to 15 years, this was not during active practice, but actually structural and anatomic thickness change of the cerebral cortex. So that's anatomy, structure. They don't have to be doing meditation at that particular time. But the three recent studies which I shared with you, the SPECT, the PET, and the functional MRI, were indeed done during the time when the activity of meditation was going on. And for those individuals doing that activity, it shows that there was increased blood flow in that area, shown by three different technologies. An increased flow in any area represents that area of the brain is much more active during that process. So what happens is, when you are meditating at that particular time, that particular portion of the brain gets more blood supply because the study showed increased oxygen level, or the image shows increased density or increased photon activities. So we know that area functions more intensely during the meditation process. And my particular surmise or projection or conjecture is that because there is increased amount of blood supply in that area, just like we supply water to the plant grows well, so too the increased blood flow to that area, one would imagine that that particular brain grows more thick. And perhaps everything in our body, Lord, it comes as an anabolic, catabolic, builds, destroys, builds, destroys. So if the building process has continued through the process of meditation, the destructive process, which is an integral part of a human body, is structurally diminished, mathematically diminished, because the increased growth continues to increase, whereas the decrease is compensated by increasing growth. So that's why the last slide which I showed that even though the person was aging, the cortical thickening of the brain was still maintained at a fairly good level. So I think if we are talking about remaining young forever, that's one way of remaining young forever. Yes, ma'am.
Is there any clinical correlation in these studies at all?
Clinical correlation is basically their feeling of peace, comfort, relaxation, their way of capacity of cognition. They're doing the clinical work. That was shown. But again, that becomes more a functional study where I feel that I'm much more concentrated, I'm able to do more effectively. That's true, but it's very difficult to calculate mathematically that somebody's brain is functioning more efficiently because he, she, or it is doing it.
No, they can't do it by finding out the memory, finding out the physical activity, because that's what some of them have done. As their brain and blood supply, the oxygenation goes down, their capacity to do a lot of activities, thinking, remembering, walking, talking, and able to do the regular activities, which you can show when the blood supply is slowly going down.
There are no scientific reports reported, so I cannot.
Yeah, there is no correlation.
Yeah, I mean, there are no reported. They have been maybe going on the lab yet, but not published yet. Yes, Naina first, then you.
pranayama on a very regular basis also practicing healings. And I don't know if
I'll answer that question because I'm going to go through that subject detail. You had a question first, let me get it.
When you're meditating, is there a way that you can know that you're creating the delta and beta waves? Is it just you're feeling a very deep relaxation and then you know you're in that zone?
Yes, as a matter of fact, there are certain changes that take place. Your blood pressure goes down, your pulse rate goes down, oxygen intake goes down, skin resistance increases. So structural measurements have demonstrated no question about the changes takes place. So that has been documented. Again, personal feeling of well-being, comfort, relaxation, improved cognition, memory, that becomes subjective. Again, functional, statistical figures have not been out. Now, to answer it quickly for you, regardless of what kind of meditation one does, the results are the same. Only thing is feeling of well-being. Only thing is depending upon what kind of meditation you do, the activity in different parts of the brain varies, which I shared with you, the study between Buddhist monks who do concentrating on one part and shunya, whereas those Franciscan nuns who did on prayer concentration, they are trying to remember the particular prayer which they have to sing over and over and over again. So that area basically was going on. Mantra is different. Let me explain to you. Obviously I can't talk about varieties of meditations in a very short period of time. When we talk about transcendental meditation, made popular by Mahesh Yogi and of course followed by Beatles, etc., etc. It's typical 20 to 30 minute practice, usually a couple of times a day. Attention is focused on a specific word, image, sound or mantra. That is transcendental. Yoga meditation is a classic Patanjali yoga with dhyana and samadhi. When we talk about asana that Lori does, this is basically Ashtanga yoga where it goes through 8 steps. That means it starts with 2 do's and don'ts, yama and niyama, certain ways of living life. Then you basically do pranayama. Basically you are controlling your breath and prana is oxygen. And you are taking deep breath, holding it and exhaling for a long period of time. So increasing the oxygen supply to your entire body and primarily to the brain. So pranayama. Of course, in between you have the asanas, positions to keep your body supple. Then you have to start doing is dharana, where you're trying to concentrate on one particular aspect. Pratyahara is basically a higher form of dharana, where you're able to take the distractions away. And then you do the dhyana, where you start meditating. And when you meditate for a long period of time and you're really in trance, quotes unquote, that's called samadhi. So these are the 8 different steps, starting with yama, niyama, and going all the way to samadhi. So that is Patanjali Yoga Shastra discovered about 2500 years ago and refined in different ways. So people think that asanas, the postures, is the meditation. No, don't misunderstand. It also has been used by various ways where you can see tantric yoga, different kind of kundalini yoga. When they go in extreme form of any of these steps can produce different kind of trance steps. But the Patanjali yoga is basically going through the dhyana and samadhi. That's what it is. Now we talked about yoga, I'll go to that again one more time. Meditative prayer is a form of religious contemplation seen in Christianity, Judaism and Islam, wherein the devout practitioner focuses attention to a certain phrase or prayer from a given religious text, Bible or Quran, with the goal of opening themselves to and attaining oneness with certain divine entity, like Jesus Christ or Allah. So that is called the meditative prayer, and that's what I was showing you in the Franciscan. Now Zen meditation is different. Now Zen meditation comes from Mahayana school of Buddhism, is found in Chinese, Japanese and Korean cultures. Goal is to enter that satori or the enlightened state usually practices meditating on the traditional riddle or puzzle known as koan. I'm not expert on that, but you got to go back to the people who do Zen meditation. Then Vipassana meditation is insight meditation, which is basically looking inwards to the bodily function and consider it that way. There's a Theravada Buddhism meditation where it's found in Thai and Burmese culture. Don't write it down, I'll send it to you. Whoever send me the email, I'll send it, don't worry about it. Theravada Buddhism, found in Thai and Buddhist culture, passively observes their present thoughts and bodily sensations with the goal of increasing equanimity, a state of passive acceptance that relies on awareness of these thoughts and sensations. So when they are just doing breathing, you identify with your body, just passively doing nothing else, just sitting quiet. Just like your mother said, sit in the corner, don't do anything. So that was the passive meditation, you relax after that. So these are the varieties of meditations you can talk about. And of course, in Hinduism, you can do the Kundalini, Sahaja, and different kinds of meditations as well. But again, the key is exactly what you were asking, and doesn't matter what method you use, as long as you get away from the not synchronized activity of life, which really keeps you at the edge and tightly wound up. Even if we take a few minutes a day, at least half an hour a day, where we do nothing, or basically consider one thing. And the reason of considering one thing is taking away distractions from others. That's the reason why you concentrate. You'll be able to find a distinct change and improvement in your personality. Okay. Yes.
Can I just add to what you said, sir? So, all these things, the yoga, pranayama, meditation, and job, this is what I phenomenally help to synchronize your chakras. And believe that if different body type, different personal type, they have different needs. Some may be more, yoga versus maybe just the meditation. So I think it's very a great personality to different people out there. But we all I think have the same goal, balance the chakras.
Good. Any other Paranam, you were saying something? Yes, please.
Meditation have any effect on irregularities like ADD, attention deficit disorder, beneficial to those?
Good question. What I can report is what has been scientifically published. So I have not come across a specific article which explains if it benefits or not. But my, again, purely subjective feeling is that any individual benefits from it. The key is even if you're able to keep a person with ADD quiet for a certain period of time without agitating him further, it should benefit. But this is a subjective answer to you. If I say something, it is true, then I give you a reference. Every statement that I made this morning has a scientific reference, I can refer it to you anytime. Because that's the way the scientific world works. Unless you have a specific research done which is double-blinded, there is no bias involved, then only you can take it as a scientific